can stress hurt my heart? Did you know that if you take care of your emotions, then you take care of your heart? Here's why you should do this and how. First, let's understand the mind-heart connection and how emotions affect heart health. There's a thing called the heart-brain feedback loop. It's well known that stress can impact heart health, but what's less commonly discussed is the heart-brain feedback loop. When you experience stress or anxiety, your brain releases stress hormones like cortisol, which can then affect heart function. But it also works the other way. Poor heart function can affect the brain, leading to symptoms like brain fog or mood swings. Understanding this two-way relationship can help patients take control of both mental and physical symptoms. A field known as neurocardiology studies the interaction between the nervous system and the cardiovascular system. For heart failure patients, activities that stimulate the vagus nerve, part of the autonomic nervous system, can help lower heart rate and blood pressure, reducing anxiety and anxiety-like symptoms. Techniques like deep breathing, humming, or even cold water face splashes can stimulate the vagus nerve. Let's travel a little beyond the basics for mindfulness and well-being and look at mindfulness techniques tailored for heart patients. While general mindfulness techniques like meditation are helpful, specific approaches for heart failure patients can be even more effective. Guided imagery, where a patient imagines their heart functioning healthily while breathing deeply, has been found to help with relaxation and reduce perceived stress levels. If you struggle with the idea of mindfulness, then there's a similar way to approach it involving movement. Many people think of meditation as something that you do sitting still, but mindful movement can be especially beneficial for heart failure patients. Activities like Tai Chi or gentle yoga, integrative physical exercise with mindness like walking can help particularly benefit patients by staying active without overexerting and also calming the mind. If you're considering counselling, then finding the right fit can be really important. There are also two types of therapy that are particularly helpful for heart patients. Heart-centered therapy, or HCT, is a lesser-known form of therapy that integrates traditional talk therapy with mindfulness and breathing exercises that focus on the heart. It's based on the idea that the heart is not just a pump, but a center of emotional experiences. HCT aims to help patients basically release their emotional stress stored in the heart area through specific breathing and mental visualization exercises. ACT, or acceptance and commitment therapy, is another form of therapy. While cognitive behavioral therapy, or CBT, is widely used, ACT can be helpful, particularly for heart failure patients, because it focuses on accepting negative thoughts and feelings rather than trying to change them. This approach can be beneficial for patients who feel overwhelmed by that constant need to fix their anxiety. ACT encourages them to accept their situation while still taking steps towards a fulfilling life. Then you might also think about the role of nature and green therapy in stress reduction. There's a thing called forest bathing. This is originating from Japanese traditional bathing, but in forest, involving immersing oneself in a forest environment. Even short visits in a natural setting has been shown to reduce stress hormones and improve heart rate variability. Heart failure patients can benefit from spending time in a park or any green space, even if it is just sitting under a tree for a few minutes each day. There is a thing called earthing or grounding. This involves walking barefoot on grass, soil, or sand. Some studies suggest that physical connection to the earth may help stabilize the body's electrical system and reduce inflammation, which could be beneficial for heart health. While the evidence is still emerging, many patients find grounding to be a very calming practice. There is also alternative stress reduction techniques like acupressure and reflexology. Acupressure is a technique which involves applying pressure to specific points on the body and can be useful as a tool for reducing stress and anxiety for heart failure patients. The P6 point is located on the inner wrist and is known to help alleviate anxiety and nausea. Patients can be taught simple acupressure techniques to use at home when they're feeling overwhelmed. Reflexology, similar to acupressure, involves massaging certain points on the feet or hands that correspond to different organs relating to the heart. Reflexology for heart failure patients can be done by a trained therapist or practiced as self-care. It's another way to help relax the body and the mind. And then there's the power of social connections. More than just support, social prescribing, which can support people in different ways, such as providing support groups, can be valuable. And an emerging approach called social prescribing involves prescribing community activities that bring a sense of belonging, such as group exercise classes, art therapy, or volunteering. This approach helps patients reconnect with the community and adds purpose to their daily lives, which should never be underestimated. This can alleviate feelings of isolation in particular. And then there are things like therapeutic laughing. Clowns, I think, have been used in this space. Joining a laughter yoga class or simply scheduling time for humour can boost mood and even improve heart rate variability. Laughter therapy has been shown to reduce stress hormone levels and can be fun and lighthearted and a great way to bond with others. Then creative outlets like doing art or enjoying music or making music or even painting, such as an art therapy, can be a great tool. Expressive activities like painting, drawing, or crafting can help excessive stress be reduced. These activities promote relaxation and provide an outlet for expressing feelings that may be difficult to verbalize. Art therapy sessions led by professionals trained in heart health can be especially tailored to the needs of heart failure patients. Music therapy is another form of great therapy. Listening to and or playing music can have a direct calming effect on the heart. Slow tempo music has been shown to reduce blood pressure and heart rate. Music therapy for heart failure patients can involve creating personalized playlists or soothing music or participating in guided music sessions with a therapist. Journaling and writing therapy can also be great. Regularly writing down your thoughts and feelings has been shown to help manage anxiety and depression. Heart failure patients can use journaling to track their emotional states, express their fears or hopes, and reflect on positive experiences. Sleep and relaxation techniques are really important. You can use things like progressive muscle relaxation. This involves tensing and then relaxing different muscle groups to reduce physical tension and promote relaxation. Heart failure patients often experience discomfort and stress-related tension. PMR can help ease these symptoms. Guided sleep meditations are also really great. Many patients with heart failure struggle with sleep due to anxiety or breathing difficulties. Using guided sleep meditations that incorporate breathing techniques and calming audio can help patients feel much more secure and help them fall asleep more easily. Non-sleep deep rest or NSDR protocols, such as yoga nidra, are guided exercise, usually performed while lying down or seated in a comfortable position, and asks you to survey body parts, feeling them and following a flow. This doesn't involve formal meditation, nor does it mean that you sleep, although falling asleep can happen, and if you need that time, then that's okay. These protocols can actually help you rejuvenate your energy and can be done in 10 to 20 minutes. Some studies have shown increased neurotransmitters that improve energy and focus after regular practice. There are also benefits of integrated care models. Some clinics offer integrated care where a mental health professional or social worker is part of that care team. This allows for holistic management of heart failure, addressing both the physical and the emotional needs in a coordinated way. Psychoeducation in heart failure is really also another valuable tool and option. Mental health professionals can provide educational sessions specifically designed for heart failure patients, focusing on how the stress impacts their heart health and teaching coping strategies tailored for their condition. Whatever it is that you need, then you can find help and support. If you need such care, then please consider this as an important part of your road to health. Stress, if not well managed, can cause adverse outcomes. Managing stress doesn't need to be expensive or complicated. Find small moments to practice some gentle breathing and clearing your mind, even if it's just for a moment. These small steps can help build until you have more skill at changing your emotional state quickly. And if you can self-regulate, then you have a greater chance to let your body do its own healing. This can be a great adjunct to your medical care and make every day more fulfilling. Please leave me a comment below if you have any queries or concerns, and please subscribe to the channel. This will help get it out to more people like you who need this information to give them better quality of life. Thank you.